Good afternoon, and thank you for joining us for the New Start Foundation's virtual addiction and mental health webinar, Singing in the Mud, Psychological Strategies for Managing Anxiety and Mental Health in the Age of Uncertainty. Our first speaker today is Dr. Anita Federici. Dr. Federici is a clinical psychologist and the owner of the Center of Emotion Regulation. She's a registered member of the College of Psychologists of Ontario and the elected co-chair for the Suicide and DBT Special Interest Group for the Academy for Eating Disorders. Ladies and gentlemen, please welcome Dr. Anita Federici.
Hi, welcome everybody. It's a real pleasure to be here with you over your lunch to talk about something that is really important to me and something that is coming up in a lot of the consulting work that I do. So without further ado, I'm going to start our session this afternoon talking about why I called this talk Singing in the Mud. Some of you may be familiar with Admiral McRaven's speech. It sort of was an internet sensation when he gave it some time ago. And ever since I heard it, it stuck with me. It's something I talk to clients about. It's something I talk to my colleagues about. And it really reminded me of how we're all feeling in COVID and how COVID has affected all of us in healthcare. So can I, without going too much into it, I want to read to you this section of his talk before we get into the new normal. So he talks about the 9th week of training. And as I'm reading this, I want you to think about your own life over the last 5 months and how this connects or relates. The 9th week of training is referred to as Hell Week. Perhaps we could call the last 5 months Hell Months. It is 6 days of no sleep, constant physical and mental harassment, and a special day at the mud flats. As the sun began to set on a particular day, his crew was ordered into the mud. The mud consumed each person until there was nothing visible but our heads. The instructors told us we could leave the mud if only 5 of us would quit. Only 5, just 5, and we could get out of the oppressive cold. Looking around the mud flat, it was apparent that some of us were about to give up. It was still over 8 hours till the sun came up. 8 more hours of bone-chilling cold, chattering teeth, shivering moans. It was hard to even hear anything. And then one voice began to echo through the night. One voice raised in song. Now the song was terribly out of tune, but sung with great enthusiasm. And one voice became 2, and 2 became 3. And before long, everyone in the class was singing. The instructors threatened us with more time in the mud if we kept up the singing, but the singing persisted. And somehow the mud seemed a little warmer, and the wind a little tamer, and the dawn not so far away. And if there's anything I've learned about my time traveling the world, he says, is the power of hope. And as I listen to his speech and I think about where we've all been, I think about what our new normal looks like. And our new normal is sort of like the mud flats, I think. It has pushed us to an edge that I don't think many of us could have imagined. You know, if you had asked me a year ago that this would be what reality looks like, I don't think I would have believed you, because it just seemed like something so far out of the norm. So think for a moment how you have struggled and tried to adapt to the new normal. Some of the things that I've listed on this slide here relate to routine changes. A lot of the folks that I'm working with, their shifts have changed. They've been deployed to do things that they don't normally do. There is a collective fear, and I'm going to talk about what this fear is doing to us from a brain perspective in just a moment. We're afraid. We're afraid of contracting the virus. We're afraid of spreading the virus. Some people I've worked with who are on the front lines, they've actually had to leave home, leave their families so that they could work in a hotel so as not to possibly transmit to their home. The sense of isolation is overwhelming. Maybe some of you feel that. And while many of us have shifted to Zoom as we are today, you and I both know that Zoom is not the same as sitting together with people in the same room and being able to laugh and hug and do those sorts of things. If your life looks anything like mine, I'm a full-time clinician and I'm a full-time single parent. And let me tell you that homeschooling while you're doing that is not an easy experience. And I know a lot of my friends and colleagues have been struggling. I've seen a ton of unbalanced eating. We're going to talk about that. I've seen a lot of substance use. And I've also seen a lot of pandemic oversaturation. Perhaps this is happening to you. It doesn't matter where you go. It doesn't matter what you log into. There is a constant stream of COVID-related media, and that actually creates the problems that I'm going to talk about today. And like anybody, we aren't particularly built for uncertainty. That's the great irony of being a human in the universe. And so COVID has propelled all of us and our clients and our colleagues into having to tolerate uncertainty. So let me tell you a little bit about what this is doing internally. And so the next slide that I have starts to talk about what's actually going on. A lot of people, I just had a colleague and he contacted me and he said, how do I know if I'm distressed? And we started to talk about, like, at what point do you know you're not okay? So think for a moment about yourselves. And when I go through this list, if this sounds like you, then this talk might be really helpful right now. So one of the things is the persistent anxiety or worry or insomnia or irritability. So this is the inability to turn any of it off, right? People may be noticing this about you. Tearfulness, crying episodes, feeling depressed. I had a colleague that reached out to me not long ago. And, he said, I actually think I'm depressed. I don't think that I'm handling COVID okay. It's taking a toll on my marriage. It's taking a toll on lots of things. And I thought, how good for him to be reaching out. Anybody have procrastination going on or dreading going into work? So I'm seeing that in some cases. Apathy, a lot of anger. Oh, there's a lot of anger going on out there. A lot of judgment, a lot of cynicism, a lot of criticalness of self and other, which to me is an indicator of emotion dysregulation. Anybody feeling exhausted? Anybody having problems with sleep? That's very persistent these days, more than normal in terms of my experience. Use of alcohol, drugs is really substantial. There was an article that came out recently in the Globe and Mail talking about the higher demands and use of drugs and alcohol happening across the country. And we do see something called COVID nightmares. So you're starting to see this sort of trauma responding, if you will, to what's actually happening in our world. So why does this happen? As someone that studies emotion dysregulation, what I can tell you is that COVID has created a sort of collective threat. COVID has shifted our sense of safety and predictability. Everything that we thought we could count on, even the most basic things, has shifted. Right? And if you think about, Maslow's hierarchy of needs, our sense of safety and knowing where we're going to get food and finances and all of that is absolutely core to our well-being. So what's happening with COVID is that our sympathetic nervous system, our fight and flight response, is in overdrive. Even the best of us, those of us who tolerate these things really well, are struggling because our brains are reacting to threat. Okay, so that's the first thing to be mindful of. And this is a slide that we use. Those of you that are trained in DBT probably recognize this slide. And man, does this have everything to do with each one of us. We all get triggered and we all feel emotionally dysregulated. Okay, that's normal. In a pandemic, we're triggered a lot. You're triggered when you go to the grocery store, and you're triggered when you have to put a mask on, and you're triggered when you're homeschooling, and you're triggered when the computer doesn't work the way that you need it to and you've got a meeting. And we instinctively feel emotion. So there's nothing abnormal about that. But in a pandemic, this system is highly activated. And the question I have for you is, how are you regulating your emotion? So if you look at my drawing and you look at the caricature that has the mallet, right? What do you put in that third box? And what I'm seeing is that people are coping with their anger, their fear, their embarrassment, with things like drinking more, smoking more cannabis, by not setting appropriate boundaries, by not eating properly. I had one gentleman I was working with that would excessively check, not just the news, but he would check the death count. And that became a major focus of our treatment, is that, you know, it's going to be hard to feel regulated when you're constantly looking at what's not going well. And yet when we're in threat responding, that's exactly what we do. And the problem with this model is that these things lead to temporary relief. Yeah, you have a drink at night and you sort of feel a little bit better. Okay, but the next trigger, you're back into a system of threat responding and emotion dysregulation. And you're just like a hamster on a wheel going over and over, and we're not really solving anything. So this is always the big question. People say to me, okay, Anita, that sounds like me. What on earth do I do? Well, I'm going to go through as quickly as I can, because I only have you for about 20 minutes. So I'm going to go through some of the best strategies that I have and that I've been talking to my colleagues and patients about over the last 5 months. To me, mindfulness is probably the greatest superpower skill you can hone in on right now. One of the greatest tools you have is your awareness. So let me unpack this a little bit. Mindfulness is powerful because it helps you downregulate. When you are in a threat response, so you see in my diagram, the green area of the brain, well, that's called the limbic system. And the limbic system is what we think about when we think about the amygdala, right? The fight, flight, or freeze response. So this whole section, though, of the limbic system has to do with memories and how we respond to emotion. And when we are on autopilot, when we are in threat mode, this part of the brain takes over. This part of the brain gets a ton of blood flow. So if I were to scan people who have a lot of anxiety or who are really not coping well in COVID, and I put them through a functional MRI, I would likely see a lot of activation in that section of the brain. Why is this important? It's important because every time you practice mindfulness, every time you choose where your attention goes, you move blood flow away from the limbic center of the brain and into the prefrontal cortex. So this part of the brain, so that front part of the brain in my slide, that's your prefrontal cortex. And that's where we can override emotion. That's where we can judge and evaluate things. But when we are not feeling okay, we get less blood flow to the front prefrontal cortex. So we're driven, in essence, by our emotion. And I see this a lot. I see this in how people are coping with the pandemic, in the levels of anger and frustration and fear. A lot of this is limbic system activation. Mindfulness actually reduces activation in the emotional center of the brain. Studies have shown over and over again now that if you practice mindfulness, even if it's just for a few minutes a day, like even right now, noticing, where's my breath? Is it shallow? A lot of you are probably breathing all up in your chest. Now that helps if your goal is to hyperventilate. If your goal is to feel calmer and more regulated, your awareness of your breath and the ability to say, I need to take a deeper breath, is actually going to change the way your brain is working. We actually know that 8 weeks of mindfulness practice, including what I'm going to talk about on this next slide, actually shrinks the amygdala, right? I think that's fascinating. So these are tools that you can start working on today. One of the things I teach people is to become aware of what state of mind you're in. So think about yourself over the last 24 hours. If you've been in emotion mind, you probably feel like emotions are driving the bus. You might feel exhausted. You might feel like you're engaging in behaviors that you might normally not do. You might say or do things. This is when emotions take over, when the limbic system is driving the bus, and logical stuff doesn't matter. You are just thinking about emotion. Now, that's an important place to be when you want to be creative and when you want to connect with people. You know, we fall in love in emotion mind, but you don't want to live there. And a pandemic pushes people to live in emotion mind. And that's not a healthy place to be. And you'll never feel grounded if you're living in emotion mind. Rational mind is sort of the polar opposite. You know, I often refer to, I don't know if you watch The Big Bang Theory, but Sheldon Cooper, who probably is a character with Asperger's disorder, but he's a character who is dominated by very logical, fact-based reasoning. He really doesn't have space or interest, if you will, in emotions. And while he's not wrong about what he does or says, he misses really, really important social and emotional cues. And one of the things that I'm seeing in the pandemic is that some people are responding by being really over-controlled, really rigid, not open to new experience, isolating more. And of course, there's a time and place to be logical. There's a time and place to be more over-controlled with emotion, but you don't want to live there. And the goal is to get to wise mind. Wise mind is that place within us where we can feel our emotion. We can feel scared. We can feel angry. We can feel the adrenaline as we deal with all the uncertainty, but we never lose sight of what's logical or what our long-term goals are. When I'm training clinicians, I often say to them, if you're going to go in and do some really hard clinical work, you need to be in wise mind. You can't go in there in emotion mind. So one question I have for you as you listen today is, where have you been in the last little while? And I know for me, just the mindful act of noticing that I'm in emotion mind is enough to actually kick me out of it and into wise mind. So sometimes it's just that ability to say, yep, I'm in emotion mind. I need to shift. So these are some strategies that you can use. But what if it's really difficult to start to pay attention to yourself? What if it's really difficult to start a mindfulness practice, which it is for a lot of people? Let me talk to you about really concrete ways to downregulate. So one of the first things I need people to do if they notice that they're just not coping well is to look at some basics. So again, those of you in DBT, none of this is unfamiliar, but I'm asking you to apply it to yourself, which is, where are you using the please skills? One of the things that I'm seeing is a pattern, especially in healthcare. What do we do as healthcare practitioners? We take care of everybody else. We take care of our clients, our patients, our staff, our kids, our families. I don't know how many clinicians, managers, parents have said to me in the last 5 months, my self-care has gone out the window. And while this seems simple, this is the stuff that makes or breaks your emotional vulnerability. So if you have a physical illness and you're not taking care of it, which a lot of people in COVID are not doing because they don't want to go to the doctor, they don't want to go to the hospital. This is a problem when it comes to emotion regulation. I need you to be taking care of yourself. If you aren't eating properly, right? And now I'm someone that specializes in the treatment of eating disorders. So, I have a bias here, but you can't be emotionally regulated and have unbalanced eating. Those two things don't go together. And yet it's the first thing that starts to go. Are you avoiding mood altering drugs? I had a client last week, and she said, I don't know, I'm just so agitated. I'm angry all the time. I'm snapping at my kids. And and we started to talk about her substance use. And she said, I don't drink alone. I have a drink or two, at night with my husband. And I said, you have to appreciate that even though you don't see it as a problem, that's still a depressant. So to what end does that contribute to the irritability and the emotion that's going on? Is your sleep unbalanced? And what are you doing to maintain healthy sleep hygiene? I don't know if you're like me, I'm on my phone or on my computer well into the evening, and it's actually not good for my sleep. And then there's the activity. COVID has certainly shifted us out of our routines, right? Can't go to jujitsu, can't go to yoga studios, can't go to the gym. And while that's changing a little bit right now, it has really shifted our activity levels. These things that I'm talking about on this slide, if these are out of balance, you're more likely to be vulnerable to emotion mind. So I invite you to think about, where are you on this continuum? But let's look at some other more intense ways of downregulating. Now, I don't have time to go through all of these. The one that I'm going to highlight is the first one, which is temperature and cold water. And what I want to say about all of this is that if you notice that your arousal levels are high, if you notice that you're agitated, angry, anxious, there are evidence-based things that you can do that help to shift your brain out of that mode. And that's what the tip skills are about. So if you think about temperature, if you think about cold water, if you can actually submerge your head. Now, I understand that you might not be able to do this at any given moment, but if you can actually get into cold water, you elicit the dive response. You actually drive your heart rate and your blood pressure down. So intense exercise does this, changing your breathing does this, but these are surefire ways that you can actually reduce what's going on internally so that you feel better emotionally. And that's what this slide sort of just covers, which is that there's something called the mammalian dive reflex. And you can't underestimate how powerful these skills are. I had a client a couple of months ago who actually couldn't sleep because he kept worrying, couldn't stop worrying. And I talked to him about this skill, and he thought I was, I don't think he thought this was a very effective skill when I told him about it. But he said, he came in, he says, I tried your cold water shower idea. And I said, okay, how did it go? He says, I couldn't sleep. So I got up and I took a shower, and I thought this was going to keep me up all night. Turns out he gets into the shower for like 15 seconds, cold shower. It's a bit of a jolt. He comes back to bed, heart rate's lower, blood pressure lower. He says, I slept like a baby. I said, and of course, right, because that's the science. That's what happens when the brain or the head is in cold water. So these are things that you could try. These are things you could try with your clients as well. Really, really helpful. Paced breathing is another one to think about. You can download apps, but the idea is that you actually deliberately slow down your breathing. So most of us are, and so this is just an example, but an app like this, you would actually follow the little white ball up and down the blue ramp, if you will. So you would inhale for a count of 5 and hold, and exhale and hold. And the app will actually just walk you through this. And if you do this for 3 to 5 minutes, you will notice a substantial change. Now, again, do these things solve all your problems? No. Does it make COVID go away? Of course not. What it does do is it makes it more likely for you to tap into your more grounded, wise mind so you can actually cope and respond effectively, not from a place of emotion dysregulation. Okay. A few other ideas. Learn to validate yourself, learn to validate others. There is so much judgment and criticism going on. right now, especially with those of you that are parents and having to decide whether or not to send your kids back to school. There's a lot of harshness out there. Harshness and criticalness and judgment is what we refer to as invalidation, right? And when we invalidate ourselves or others, it actually drives up arousal. So we actually feel more dysregulated the more we judge and criticize. And when we do that, we actually decrease our ability to take in new information. So my strategy to you, and I've got a few examples on the next slide, is start to pay attention, be mindful of the dialogue that you have going in your mind. What is it? What's the story that you tell yourself? So if you look at this slide in terms of what validation sounds like, it might be something like, it makes sense that you feel so overwhelmed trying to balance homeschooling and work. That's a validating statement. And it actually translates, if you look at the science, it translates into less physiological arousal. I am doing the best I can right now. That's a validating statement. Wearing a mask all day is difficult and uncomfortable. Many people are feeling more agitated these days with so many restrictions and changes, right? You don't have to agree with somebody. You don't have to like what's happening to speak in a validating manner. So even if you practice this yourself and with your colleagues, you will know, even when I say it out loud in this presentation, there's a bodily felt sense that comes with saying, you know what, I'm doing the best that I can right now, and that's okay, that's good. So practicing validation is key. Another area that really, I smile when I say this because I have these struggles as well. Boundaries. Anybody else out there with me? Are you struggling with setting boundaries? And now that we're moving into stage, 2 to 3, oh my gosh, talk about confusing. So I saw this on Instagram and I love this. So boundaries during a pandemic sound like, thank you for the invite, and I'm not comfortable attending. I know I'm home more, but I'm not always available. I'm okay with dining out, but we need to sit outside. So you guys can read through these yourselves. I'm happy to send these slides out if that's helpful. The idea is that I'm noticing more and more people are really not observing their own limits. They're not saying no where they need to say no, or they're taking on more than really they can manage. Surefire ways of leading to burnout, ineffectiveness, dysregulation, and maladaptive behaviors. Right? You can't actually be grounded and not have boundaries. So those, again, two things don't go together. So I invite you to reflect on, where do I need to set some boundaries? And as we wrap up, one of my favorite power skills is radical acceptance, right? So radical acceptance is not fighting reality. It's probably the skill I've been using the most during COVID. And this slide highlights why radical acceptance is so important. So you see there's the darker line on my slide, it's purple, and it says pain. So I say to people, is life pain inevitable? Are you going to feel pain? Well, of course, I can't take that away from you. Is suffering inevitable? This is where I usually get some back and forth with people on this. So from the perspective that I teach from, we would say that suffering is not inevitable. Suffering is ordinary life pain plus non-acceptance of that pain. So when we fight reality, like if I fight COVID, I say this shouldn't be happening. So I've got a client right now who's very, very distressed because he works in a wrestling sort of MMA kind of facility, but can't go because of COVID. And that was his main way of social connection and managing his mental health. And now that's gone, and it's been gone for 5 months. and his mental health has suffered significantly. And one of the things we've had to work on is radical acceptance, because where he gets stuck is, this is stupid. This shouldn't be happening. This isn't fair. Why does it have to look like this? And it is the reality. So as he fights reality, his suffering, his pain increases substantially. His quality of life decreases. Right? So where can you practice radical acceptance? I know for me right now, it's a lot of radical acceptance on homeschooling and trying to work and knowing that I can't work as much as I would if we weren't in a pandemic. And that's a hard one for me. I like to work. I have lots that I like to do. And prioritizing my child's education is something that I won't sacrifice either, right? So I have to really not fight reality on that one, or I make it worse for myself. Before we wrap up, I want to highlight what radical acceptance is not. Now, it doesn't mean that you agree with what's causing you pain. It doesn't mean that you're helpless or you're passive. It certainly doesn't mean that you're giving up. To me, radical acceptance is one of the most empowering stances that I could help you get to. Because when I radically accept, I'm really, truly working with reality. And when I'm really working with reality, and I'm not denying, and I'm not fighting, and I'm really working with it, then I move, then I change. That's the irony of it. So I think I've talked about some of these. I mean, these were just examples of, what could you practice? You could practice radically accepting your personal limits, changes to your work schedule, having to stay home with the kids, as I've mentioned, not seeing your family or friends very much. How about radically accepting that we have to wear masks, social distancing, that you can't go to jujitsu or certain wrestling clubs at this point. And more than anything, if anything that I have said resonates with you, or resonates in a way that you see this in your loved ones, or you see this in your patients, or you see this in your colleagues, reach out. This is an unprecedented time. This is a difficult time. We're all in it, and we're all struggling, right? The most courageous thing that you can do is say, I need to talk to someone. And just know that there's a lot of help out there right now. So if you have questions or comments, you're welcome to email me. You've got my website here. You can contact me. You've got my email address. So I'm happy to send you slides. I'm happy to help out in any way that I can. So I do know that there's a couple of questions. And I think the first one is, right, how do I practice mindfulness regularly? That's a good question. So mindfulness, I would encourage you to play with different ways to practice mindfulness. And what I mean by that is go online, type in short mindfulness exercises. Set a time every day, whether it's first thing in the morning or before you go to bed or when you brush your teeth, then you practice mindfulness, and start with 1 minute. Start with 1 minute of focusing on your breath. Focus on sounds in the room. Focus on just noticing your thoughts. I would look at, there's a ton of apps. I would try to integrate it into family. So if you have kids, some of the newest research coming out of neuroscience and other child psychology is helping kids learn mindfulness skills. So that's really helpful if that's something that you could add into your family life. And I know there was one question, I'm just noticing time. Where can I learn more about emotional regulation? My go-tos would be to pick up a book on dialectical behavior therapy. And I don't mean that you need therapy necessarily, but DBT is designed for emotion, for understanding your emotion, and for regulating your emotion. And if any of what I've talked about today resonates with you, it really comes from those that have published and been writing in the DBT literature. And these are good life skills. So we're now seeing them being integrated into elementary and high schools. And anyway, so I'm aware of time. So thank you so much. Thank you for having me. And if you have more questions, feel free to reach out.
Thank you, Dr. Federici. Our final speaker today is a registered psychotherapist with EHN Canada. Ladies and gentlemen, please welcome Agustina Jorquera.
Hello, my name is Agustina, and thank you very much for hosting me here and for also people joining. I mean, this is a clear testament of all the shifts that the absence of the presence of our physical bodies. So thank you very much. And let's get started on just a brief couple of things about treatment and mental health disorders. So as we get started here, a little bit about me. I currently work at kind of all three levels of care for people that are struggling with mental health disorders. I work in an outpatient facility. I also work in intensive outpatient, and I'm also working in an inpatient unit as well. So throughout today's chat, what we're really going to look at is what I'm starting to notice a lot, especially now, is that people are getting undertreated. People come in with symptoms and they have gone for a long time getting either no treatment at all or treatment that is not actually meeting the level of support that they need. So what we're going to be looking at is how do I identify a normal functioning response versus one that indicates that I'm really struggling and I may need more support. We're also going to look at determining adequate levels of support for those of you that work with clients, for those of you that maybe are with a loved one and you're seeing them struggle and you just don't know what to suggest or what may be out there to be able to help. So with that, let's just take a quick look. I know that prior to this, Anita gave a great talk about just the continuum of mental health. So I'm not going to go into too much depth of this, but just what I would really like for us to capture is that what I usually say to clients is that being under the normal functioning area of mental health is feeling sad sometimes. It is feeling sometimes dysregulated. It is sometimes having a night or two where you're having some trouble falling asleep or staying asleep. What we're really looking at here is the frequency that these struggles are happening and the duration of them, as well as the intensity. So what I often do with clients and how we often talk about the link between mental health and substance use is I actually present to clients this sort of continuum. What I really like about it is that it really goes through the phases, and these are not linear. We often kind of present throughout different areas of this continuum, but having an idea, hey, what is it that I'm struggling with? What we tend to see near the top of this, between the normal reactive stages, is that normal responses may include feeling unhappy from time to time. It includes normal mood fluctuations. It includes sometimes here and there substance use that's controlled, right? There could be substance use, there could be no substance use. As we kind of start traveling downwards in the spectrum, we start seeing that the reliance of substance use in order to help cope with psychological struggles or just emotion dysregulation tends to increase. What we're also noticing is that as we travel down the continuum here, we're noticing that somatic symptoms become increased. So there's lots of fatigue without a clear physical cause. There's overall fatigue. There is irritability. There is anger. There's a lot more acting out behavior. So things such as, for example, spending too much time playing video games or finding yourself gambling more. Those behaviors tend to increase. Now, when we look at those, we need to understand as well that these behaviors, these substance use issues, these behavioral addictions are a way to cope with the distress that takes place as we travel down the continuum. What I also use this for those of you that work with clients and you're like, okay, how do I tell the clients that they may be struggling? Sometimes we have clients that they're like, no, I've been functioning like this for a very long time. I'm doing great. And sometimes they're having trouble recognizing where they're at, I will find, through a compassionate means, of course, a way to actually have them access to this. It can be used as a motivational interviewing tool to see, okay, where am I at on this spectrum? And what I've often found, especially in the inpatient unit that I work in, when we present this to clients, it can be very validating because they can take a look. And the language that this uses a lot of the physical sort of medical language that sometimes helps normalize mental health and able to talk about it. So as we kind of move on with this idea of continuum of mental health and how much help, how do I know if I'm getting undertreated? What is the right level of support that I need? Often, again, what comes up in my work is that people have gone on struggling for a very long time, or they've accessed treatment, but it was either too much intensity for where they were at that moment or little intensity. So there was this kind of mismatch. What I usually kind of put out there, and through EHN, we also offer the 3 sort of different levels of support and care. At the most kind of less frequent level, less intensive level, we have outpatient, right? So sometimes we get people coming in through outpatient. They may join an individual session a week. They may join perhaps a recovery-based group that's for an hour and a half or 2 a week. It tends to be no more than an hour of therapy per week. Usually clients that come in through this route, they're either starting to identify that they're struggling, or they're starting to get their feet wet with supports, and that's how they might come in. At the kind of next level of intensity of care, we have what's called intensive outpatient supports. So with intensive outpatient supports, the frequency and intensity of therapy significantly increases from just the first level we were looking at. So here clients are still living at home. They're still attending to the 3 spheres of their lives in terms of relationships. They're still attending to work, perhaps. They're still attending to play and hobbies and self-care. But they're finding that one aspect of that is really starting to struggle. So intensive outpatient is about anywhere, usually throughout Ontario anyway, it's anywhere between 10 to 12 hours of therapy supports throughout the week. And sometimes people that come in through intensive outpatient supports, they're really noticing that a significant part of their lives is really starting to struggle, whether it's relationships. What I often find is that people accessing intensive outpatient supports, they tend to have just gone off work. So they're quite not sure, this may be the first time that they're going off work. They may feel quite scared, and they're also struggling to get better with just outpatient supports. At the highest level of intensity, we have inpatient support. And with inpatient support, of course, this ranges depending on where you go to get this type of treatment, but typically what we see is anywhere between 7 to 12 weeks of residential care. People that I typically see that come in through inpatient, their lives have become unmanageable. And what I usually tend to see is that now there's a safety concern here. So often people coming in through inpatient, remember we were looking at the continuum of mental health, they're getting to the point where their behaviors are actually compromising safety. And by safety, I don't just mean physical safety, but I also mean psychological safety. So a lot of people that come in through inpatients, they're struggling to, for example, get out into social roles, get out of their homes. They're isolating, they're withdrawing, and they're also perhaps having lots of aggression, lots of irritability, acting out behaviors. Something I'd like to note that I didn't make super clear on the slide is that with outpatients, if we go back to that top, like the top line there of outpatient supports, what we often find too is that becomes fundamental as people leave inpatient support. Okay? So let's talk a little bit more about this idea of inpatient treatment. I often get lots of questions from employers. I often get questions from loved ones. I often get questions from other therapists and colleagues of when is it a good time? What is the goal for inpatient? And I usually, something that helps me is if we divide our kind of directions in life and, ability to maintain relationships, ability to work, and ability to play, what I often find is people needing inpatient treatment, those three spheres have really been tampered with. They're unable to meet the demands that those three spheres require of them. Okay. And this is where we see a lot of severe substance use, okay, and an inability to control the use. So really what it becomes about is when people come into inpatient treatment, they're often struggling a great amount. What that also means is that the goal of in treatment is not to fix people. It's to acquire a sense of stability. So what we're looking at is how can we provide the opportunity for this patient, loved one, employee, whatever your relationship is with that person, to find some symptom alleviation and get coping skills in order to regulate. That becomes our main focus. Behavioral activation is another one of our goals. Oftentimes, people through inpatient treatment, they attend a plethora of different groups. They attend individual therapy as a result. But what I often say is the mere act of just cohabitating with other people, with having to get up at a certain time, with having to attend physical activities, with having to attend meals, with having just a schedule of where things are happening is the therapy in itself. And often when people come into inpatients, their sense of schedule is completely off, or it's being suffered with. So really the therapy in itself in an inpatient treatment facility is just the mere acts of the ins and outs of daily living and regulating that as it comes. Okay. Also, just increasing skills. Anita talked a lot about DBT skills. So this is something that we also in an inpatient treatment is a great tool to have. Getting skills so that when that person leaves, they're able to apply those and regulate and attend to those three spheres in our lives. As we move forward, really something, and I usually show this to clients, and I really encourage people that if you're thinking of referring somebody, or if you're thinking that somebody may benefit from inpatient treatment, what I tend to look at is, if you look at this slide, it's done like this on purpose. So think for a minute that this pie is your life, your entire life, from birth to death. Now let's add in the time that inpatient treatment takes in there. And I know that you probably cannot see it, but there's a faint line, a faint slice of the pie that I've drawn on there in the middle, like where the 12 o'clock would hit. And that's the time that somebody might spend in inpatient treatment. What this, I think, serves is that it really allows us to reflect that a lot of the work happens after inpatient treatment. Okay, and that's where I emphasize inpatient treatment can help to stabilize, but a lot of the work has to be continued. And this is especially important for people that may be employers, and you may see employees struggling. This is really important to note that transition to work will take time. Getting adequate supports post-work is fundamental in order to maintain recovery. As we move forward in today's talk, really the takeaway message that I really give based on my observations is that determining the adequate level of care and combining that with the person's willingness to change, willingness to get better, makes the perfect recipe for success in recovery or maintenance of recovery. What I typically find is that sometimes it's like, I usually say to clients, and I use this analogy plenty of times, I say, sometimes, you go to the ER, you go to the emergency department because maybe you broke a leg, right? Like, what would happen if your treating physician said, okay, let's just put a Band-Aid on it and come back next week, right? Like, you're still getting out of there, you're getting undertreated. And what we often find is that tends to be the case for people that have had experiences traveling down that continuum of mental health. So really finding the right level of care is really crucial. Sometimes the opposite is true, where people are coming into an inpatient facility, but they have not tried perhaps other forms of outpatient treatment. So they may not be quite ready to engage. And that can be just as detrimental as not getting treatment at all. So with this, some of the things that typically, in terms of questions that come up, let's take a look at the first one on here that people have. What other tools can help me determine the level of support needed? So this is especially meaningful if you are a clinician and you may be kind of stuck with a client, knowing, okay, what do I recommend? What do I do? Looking at actual outcome measures can help. So what I mean by that is utilizing things such as like the PHQ, which is a short questionnaire that a client can fill out in literally like 3 minutes, right? That looks at depressive symptoms, using things like the GAD-7, which is another measure, just to measure where their levels of anxiety are. Using the OQ-45 is another measure, which gives you an idea of the level of symptomology that the person is having, their level to attend to interpersonal and social roles. And what that can also do is help the client realize where they're at in a more objective way, looking at, okay, this is where I'm at. Am I struggling? Am I injured? Am I ill? Am I reactive? Where am I at? And that can actually increase the willingness of clients. So I usually really validate, use other tools other than yourself and bring them which can be really validating for clients and increase the buy-in in terms of providing care and providing treatment options. The next question, how much support is typically recommended for post-inpatient treatment? So when we talk about this, I often get lots of questions about inpatient treatment. In terms of supports for post-inpatient treatment work, what we usually recommend is that the person at least have a plan set up for the upcoming 6 months. Now, that doesn't mean that the person should be off work or off their regular activities that they had prior to treatment. No, what we usually see is that the longer it takes for somebody to either get back to their activities or get back to work, the harder it is to engage. So what we usually note is having a gradual transition back into not just work, but back into regular routines of life after inpatient treatment is extremely important. Being away from our structure, from our routines, from our beds, from our homes for 7 to 12 weeks is a very long time. So I look at it as like a mini migration. We need to reintegrate back. We need to migrate back into our homes, and that can take time. What we usually also recommend is really encouraging that person to stay connected with aftercare supports, right? And these sometimes are given by the treatment facility as follow-up for 12 months afterwards. I usually recommend that people, if the person is really struggling with getting out, getting up, engaging in acts of hygiene, they might want to combine, they might want to get occupational therapy coming in once a week with help from either a mental health clinician. So we usually recommend that person stay connected with mental health supports for for at least 6 months post inpatient treatment, just to get that accountability and feeling that you're also not alone after you go through a highly intensive treatment setting. So with that, I hope that this has been informative. I hope that in some ways it has provided with some tools in order to increase kind of engagement from clients in treatment, or sometimes help us clarify, like where is this person at, conceptualize where the client may be at, so that we're able to provide them with the accurate level of support and avoid either over-treatment or under-treatment. I want to thank you for hosting me here today. And again, feel free to reach out at any point if you have any questions at all. Thank you very much.